And hello again, and welcome back. We are on the closing stretch of our 82nd PACHA Full Council meeting. Thank you, everyone. It's been such an extraordinary way to spend 2 afternoons. We are down to some important business of the council for consideration. So essentially, what we will do is we have some proposed recommendations with opportunity for each one of these for feedback, review, discussion, and comment. So we've organized some time to be able to do that, but really wanted to center the next part of the conversations over to three of our four PACHA subcommittees, and beginning with work that's been done quickly and efficiently, I would say, on behalf of the members of these subcommittees. It's been extraordinary work that has culminated in our considerations for this afternoon. So we'll just go in order. I'll turn the floor over to uh, uh, Jesse Mylan and Alicia Diggs, who both co-chair the Aging with HIV Long-Term and Lifetime Survivors Subcommittee for their proposed recommendation.
Good afternoon, everyone, and thank you so much. This has been an extraordinary day full of lots of great information. Excuse it, it's storming down over here where I am, so I will do my best to get through as much as I can with the time that we have. Jesse and I have worked pretty extensively. Sorry, I'm hearing some dangerous sounds in my house. Pretty extensively on our recommendations. And Jesse, if you don't mind, if you would go forward with that, I seriously need to check what's going on here.
I'm happy to. So I hope everything's okay, Alicia. Well, Alicia and I have worked really hard along with our committee, and I'm going to thank the especially Jeff Taylor and Paul Kawada and Carol Trustin, who are on that committee, and giving us the opportunity to think very holistically about what the secretary might do to help support people living with HIV and long-term and lifetime survivors. The letter that is before you has three major components. One is asking the secretary to deploy his legislative team to support, including people living with HIV as a population of greatest social need in the upcoming reauthorization of the Older Americans Act. This is something that the aging population of people living with HIV has been advocating for quite some time. And it gives us the opportunity to make sure that as we move forward under the new reauthorization of the OAR, Older Americans Act, that we are specifically included. That provision has never happened before, and it can happen now. The Older Americans Act currently has a reauthorization that expires on September 30th. And so the Congress is working very hard with the advocate community to push for the reauthorization, but the HIV community specifically wants this. I've shared this recommendation with members of Congress already on behalf of AIDS United, and I know that there are many who are willing to at least advance this issue, but we need the secretary to do so. The second major component of our letter is that we've had for many years a real concern about how people aging with HIV transition from their private insurance to Medicare. I just had literally last week a well-known senior in the HIV community who is finally transitioning from private insurance to Medicare. You all know Ronald Johnson, and he who is the former policy director, policy vice president at AIDS United, is like in terror about doing this. Why? Because we want to make sure that people living with HIV are making the right choices when they transition to Medicare, including choosing the right plans for themselves under Medicare Part D. So we're asking the secretary to work with CMS and ACL on using some existing structures or create new ones that would help create a TA center, technical assistance center, to help guide people living with HIV in making their choices. We're so grateful to ACL and especially to Andrea, who's been so helpful in crafting these recommendations so that we could understand what the resources are that are already available that could be easily adapted. And we're specifically encouraging that there be literally like a community advisory board made up of people living with HIV to help with those structures at state levels to provide the peer-to-peer or organizational support that the ACL already has. So that's the second component. The third component is that we know that states are now required to include people living with HIV in their state aging plans, but no one knows what they say. And so we're asking the secretary to make sure that his offices do an assessment of what current state plans say and to continue to keep that assessment updated and made it public so that people living with HIV can see what their state plans are supposed to say or are saying or don't say so that they can continue to advocate for it and or also use it as a mechanism to make sure that when they go to services, they're getting the right services that they need. So those three components, the advancing the Older Americans Act, creating a TA center to help people transition from private insurance to Medicare, and an ongoing assessment of how states are incorporating people living with HIV in their state aging plans are the three components in this letter. I thank Andrews particularly, but also our colleagues at HRSA and CDC who have also had a chance to weigh in on this letter, and the chair of PACHA, Marlene. Thank you for your line edits and your suggestions over the last several months, and we think the letter is now ready to go. And I want to also recognize that we've included in the letter why this is so important for health equity reasons, because the population of people living with HIV who are aging represent many, many people of color, and it's important that we advance their equity as well.
And I see Dana is sharing her screen. Wonder if there is a version that has line numbers included in case there are any edits or recommendations from council members here. But while she's continuing to work to get that ready, just based on Jesse's comments, Alicia's opening remarks, please be safe. Alicia, by the way, I know that feeling about being in the house when storm winds and everything else are going around you. But definitely want to allow members any comment or reflection based on the tenets, essentially, that Jesse just outlined about what's included in the letter. And again, folks can begin to read. We posted links to all of the recommendations coming before us this afternoon in the chat. Caroline also sent them out under separate cover in an email. So everyone should have a copy, but I know is our tradition, being able to walk through the document collectively as a council before we take formal vote. So any questions or comments from PACHA members before we just review the letter itself? Okay, I don't see any. So given the first half of this letter fairly straightforward in terms of its purpose and what we're asking of the secretary, any edits that anyone can see that need to be had in paragraph 1? Okay, seeing none. Paragraph 2, I'm calling the beginning is as an advisory body. I'll give folks a couple of minutes to read through that to see if there are any edits in paragraph 2. Okay, seeing none, can we go to paragraph 3?
Yes, Caroline, Paul emailed an edit earlier today, and I called Paul about that edit because it was not a complete sentence, and he's asked, and he said he understands that it was not complete, and so it's not going to be moved forward as an edit for this letter.
I would like to offer an edit somewhere between lines 31 and 33. The demographics of HIV have significantly shifted over the past decades. Advances in medical treatment have allowed individuals living with HIV with undetectable viral loads, I think it's kind of relevant there.
Excellent.
Yes.
I think we would accept that as a friendly amendment without need for discussion.
I think, Leo, you're trying to comment.
Yes, thank you. The demographics of HIV, could we say they're the demographics of people living with HIV?
Excellent.
Glad to accept that.
Okay, next paragraph, this aging population faces.
Sorry.
No,
This-
go ahead, Jimmy.
The second to the last sentence in the third paragraph, there's a disconnect for me in living with HIV and then 70 and over. I think a comma is supposed to be somewhere there.
With the prevalence of Americans living with HIV, 70 and
Oh, that's a continuation. Okay, never mind. Gotcha.
Well, if you add the word years after 70, then I think the sentence reads easier. Or 70 years old or 70 years of age or something like that.
aged 70 and over.
Yes, there you go.
Okay.
Great edits, folks. Next paragraph.
Rather than health complications, I would recommend chronic medical conditions there.
That's just what I was going to say, Doc. And I would say that would be line 42, between 42 and 44, somewhere in there.
Yep, I think we've got it.
And how about in the last line, exacerbate health outcomes and diminish quality of life?
Outstanding.
And also, back over after the chronic medical conditions where it starts at higher rates and younger ages, or should that be at higher rates than younger ages? Am I reading it incorrectly?
I think it's at higher rates and at younger ages, I think.
Saying how long-term HIV ages the body. I think that's the reference is making.
Correct. That's what it's saying. That's what it's saying.
Thank you.
Got it. All right, we're good on that paragraph. Let's move to the next. I can't tell if you can scroll down if that's the full paragraph.
Sorry, this is Jeff with one minor edit in the above paragraph. I think probably a comma after osteoporosis. Thanks. Yep, thank you.
Mhm.
Oxford comma.
It had to make its debut, right?
But we're not ending any sentences in this document with prepositions.
Up with which we will not put.
I'll tell you a story about that the next time we're in person, Jesse.
Okay.
Okay.
But I put in the comments line 52, I would add the words "and other communities of color."
And so what's not showing on the screen for this
Oh.
document presently are the lines. So you may be looking at your own copy, Tori, if you can
Yeah.
illuminate more.
Yeah, Dana, I think it's in the moreover paragraph, the very last sentence.
Yes,
Right, Tori?
thank you. Yes, these disparities underscore the need for targeted interventions and support services that address the unique needs of these communities and other communities of color.
I will remove the word "these" in that next sentence and just say we are recommending 3 efforts by your administration.
Love it. Let's move to paragraph that says recommendation 1.
Also, instead of efforts, maybe actions.
You mean in that first opening line, that first opening sentence?
Mhm.
So after we are recommending 3 actions by your administration. Jesse and Alicia, that sound good?
Yes.
It
All
does.
these so far we concur.
And it looks like, Dana, I think you're right on it, but it looks like there's an extra period there. Yeah. Okay.
If we're going with consistency, not too far where the line is, there's another need for an Oxford comma. After reduced healthcare costs.
Carol, now's your line.
While we're on this paragraph, we need to give a shout out to ACL for their existing regulations, but their regulations are not, but those regulations would be certainly augmented by a legislation actually including people living with HIV as a population of greater social
Mhm.
need.
Yeah, ACL. Any other edits on action 1?
I think there's a lot going on in that last sentence. I'm wondering if we could, have a period after a reauthorized OAA period, and then we offer PACHA support to ACL in its ongoing implementation.
It's a good one, Doc.
That's good. Mhm.
And capitalized W.
Mhm.
You all are taking me back to my first and second year as a lawyer with senior partners editing my work, but I'm over it. This is nothing compared to my senior partners.
Hey, this is light work. This is easy. All right, we can, hopefully everyone is scrolling through second.
Can we
Second
get a
action.
comma after the CMS abbreviation? As leader of the ACL and the CMS, comma, commit. Down in the next paragraph. Right there.
Yep. Patrick, you were still on paragraph starting with 1. I missed your edit in the chat.
He wants to remove urge and. So on that second to last sentence,
Oh, I see it. I see it.
just say, and we recommend. Patrick, let me know if I got that incorrect.
Got it. Okay. Any other edits in this next paragraph, beginning with the second?
A comma after its existing framework, comma, or if an additional program needs to be established.
Mhm. Anyone else before we move on to third? Okay, let's move on.
Oh, I had one, Marlene, if you don't mind.
Yeah,
After,
go ahead.
we also request an assessment to determine whether the SHIP program can incorporate this support into its existing framework, or if an additional program needs to be established, period, because that's kind of like a run-on sentence, and that could be broken up into two. We asked further that people aging with HIV, I think that would kind of flow better.
Instead of asking further, can we recommend?
That's very strong. Thank you.
Okay, that looks good. Are we ready to go to third? Okay,
I want to recommend again there as well.
Yeah.
select all ask and replace with recommend.
And at the end of that sentence, I would say the specific provisions the states have made in their state plans on aging to address the needs of people living with HIV instead of for addressing people with HIV.
Mm-hmm.
So to address the needs of
Yeah.
people with HIV.
Yes.
And can we make it in that same sentence, your administration conducts and publicizes? That's the right agreement, right? We recommend your administration conducts and publicizes an ongoing assessment.
Mm-hmm. Mm-hmm. So Dana, we need an S on conduct.
And publicize.
Oh,
First
yeah.
line of that
Hi,
paragraph.
this is Dana. Can you hear me?
Mm-hmm.
Yes.
Hi. I hear your thing, but I believe you're asking for something to happen in the future so that you conduct. I think it's correct as in the singular.
I
Hence the
agree.
singular.
Yeah, I agree. It should be conduct and publicize in the present.
Yeah.
Okay.
Well, it depends if we consider administration a singular or a multiple, right?
It's really not about agreement with that particular subject. It's really more about the time frame.
Okay.
So the when. I don't have the word at hand. I'm sorry.
And then in the next sentence, providers at state levels are inconsistent with their approaches to serving people with HIV. I would put a comma there, and both providers, people living with HIV.
Mm-hmm.
Yeah.
And can we say healthcare providers?
And also serving people living with HIV.
Mm-hmm.
And I see, Andrea, you have your hand up. Please feel free.
Yeah, just a point of clarification. So it's not really healthcare providers that are governed by the state plan. It's our recipients of funding. So that's state units on aging and area agencies on aging. And then the local service providers, the transportation providers and the meals providers. So just a point of clarification. And then also, I don't know if we've gotten down to how frequently the assessment would take, but I just, point of clarification there, it says semi-annually, which is every 6 months. And the plans come out every year. So they're created in July, they're finalized for the next fiscal year. So every 6 months, it would just, not much would happen in December, you know? So that's it.
Thank
we-
you, Andrea, for the clarity around the providers and wondering if we might use some of the language you said in terms of the area agency on aging recipients and local service providers, if we might not want to be that prescriptive. Because that helps to define providers and not make assumptions that we all, or the readers of this letter would understand what is intended to be meant by providers.
Yeah, I think you could say Older Americans Act recipients, those would be the funded entities, and then the participants would be the people receiving services.
Super helpful, thank you. Maybe I would take out the "and participants receiving services" part right there, unless I'm incorrect. What we're
Yeah,
trying.
it's the entities receiving
Yeah.
funding.
Andrea has her hands waiting for input.
Oh, go ahead, Andrea. You had an additional comment? Oh, okay. Just check.
Jesse, was that's a place where Dana's highlighting? Was that also meant to be these same entities when you're referring to providers there?
I think it would be helpful to include both healthcare and service providers. Healthcare, comma, service providers and people living with HIV are unaware. Good.
And could we take out "of significant medical and social need" there and just say "for this population"? Others, let me know if you agree or disagree.
Isn't that the term that's used in the Older Americans Act?
Yeah, it reinforces that
Yeah.
terminology.
Understood.
And I think it's helpful for the recipients receiving OAA funds and for the state plans to recognize both medical and social needs.
Oh, wasn't there a point of clarification regarding semi-annually? Andrea, were you saying it's annually?
Yeah, the plans, so the plans last for 3 to 4 years, usually 4 years. They come up in sort of tranches, so we don't get 56 all at once. But it's a fiscal year. Every fiscal year, we're going to get a new tranche of plans. So we're not getting things halfway through the fiscal year. It's like they go up for comment in July, they're finalized by October 1st, and then the next year. So annually would keep it fresh.
So we can remove the word semi and at least annually. Good.
Are we okay with moving to "we ask"? We're almost to the end.
I think we changed "ask" to
We
recommend.
recommend.
No, I think this is that we're asking him to respond to us. So yeah, that is an
Oh,
ask.
that ask is okay.
Can we take out the "further" since this is one of our first asks? We ask that you.
Make sure to not accidentally catch the T, cut the T from that. Jesse, is there any benefit of toying with the deadline here for them to get back to us, like placing it a week before the authorization to perhaps like drive action faster or help wheels turn in a way that's beneficial?
Well, we thought about that, knowing that this PACHA meeting was about a month before the authorization ends. But I mean, I'll ask Caroline and Kay, or I'll ask Caroline, is there any need to tighten that time frame, or do you think that this is reasonable that we're asking them to respond prior to the current expiration of the OAR authorization?
Yeah, I think the way you have it now is great. I think moving it up, I don't know. He'll get it when he gets it, and I know that there's a deadline for the end of September. So I think it's fine the way it is.
All righty, any other remarks closing out this document?
I would say we look forward to your response versus positive responses, but open to other thoughts on that.
Yeah. And Andrea, is that a hand raise?
Yeah, just quickly, time-wise, with the reauthorization of the Older Americans Act, the Senate took it up. It passed out of committee on the 31st of July, I believe. The House is going to come back into session. They're going to take it up. They then have to pass it out of committee. It has to be voted on by the floor. It might not get done in this Congress. It might be the next Congress. They do a stopgap. But this doesn't necessarily end at the end of September. So just so you know, could go on.
Thank you. Any other edits to close it out before we take a vote?
Marlene, if there are no other edits, I think because this is presented by a committee, the committee is moving it. But I just want to add that Alicia and I and the committee appreciate all these edits, but I think the core 3 recommendations are ones that from all that we've just seen stand, and that's really the most important aspect of this letter, or those are the most important aspects. Those 3 things: the OAR, the assessment of the state plans, and a TA center. I think it's thank you all for endorsing those, and we look forward to your vote.
Thank you, Jesse and Alicia. You all made a commitment to this action at our last full council meeting. You're bringing that action before council to fruition. So we are ready to vote. As Jesse said, because it came from committee, it doesn't require a second. We go straight into a vote. So all those in favor, it would be helpful if you can physically or digitally raise your hand for those members of PACHA full council who is eligible to vote, and leave them for a second. Just want to make sure we get the recording appropriately of those who vote. And Wendy, I think you're not a voting member, so but thank you for chiming into the edits. Everyone for your feedback. Any abstentions? So hands up now, only for those who are abstaining. Any abstentions? I see no abstentions and any noes, any nays. By a unanimous vote, this recommendation passes. This letter with edits considered will move forward. Thank you, Adrienne with HIV. Thank you all. And now we will pivot quickly to the Ending the HIV Epidemic Subcommittee. Turn it over to Guillermo. I know Tori had to drop off. She left that in the chat. Appreciated her leadership today, but Guillermo.
Surprise. I I was in ready to move the stigma. I really had not worked indirectly, yes. But can we bring it up, the resolution that U equal U? That's what the one that you're talking about, right?
Yeah, that was the one, and I know it's not ready in the same way, or is it? Anybody can let me know, but I don't think we were ready to consider
Okay.
voting per se, or on this one for this meeting, but we did not want to wait too long. So if you'd rather have some conversation and comment about it, we certainly can vote at a called meeting at some point in the future. It does not have to wait until our December full council meeting when we're in person in Alabama. That's the point I'm trying to make. If we don't do it here today, we don't have to wait until
Got
December.
it. Caroline?
Let's have a kind of procedural question, and please excuse my ignorance. What is the difference? What's a resolution? Like, what does it do? Who does it go to? What's the purpose of a resolution? I understand a letter to the secretary, but help me understand and it's not specific to this one, it's a general question. You know, what is a resolution and who does it go to and what purpose does it serve?
Yeah, I'm happy to jump in. And of course, it's all outlined in the guiding document that we had created for PACHA as a resource. All of the recommendations, whether it's through a resolution or a letter, they go through the HHS Executive Secretary's office. So it goes through Admiral Levine, the ASH, and then goes to the Secretary for their review and comment. Typically with a letter, you'll get a response back from the Secretary's office, but it's not mandated. The heart of both is that it's recommendations for the Secretary's consideration. The letter usually provides more additional background, additional information, but essentially they're both ways for the PACHA to say, here's an issue and here's what we recommend the administration do. Does that help? Anything else to add, Marlene?
Yeah, I'll add, and again, outlined on page 4 of the guiding document, because we really wanted to give some framework around the mechanisms and tools that PACHA has to use in our work. But on page 4, and what I found with resolutions that we've done in the past, different from a letter specifically to the secretary requesting or recommending some action, the resolution may recommend action, but it has been also a very useful tool for local, state jurisdictions, coalitions, and communities to sort of give a resounding call to say, hey, here's a consensus statement, if you will, from PACHA as an organization weighing in on this issue.
I see. Thanks.
It's another tool, as Caroline said, that the guiding document of PACHA give us as a way to us to advise. You know, both letters and resolutions are very important, I think.
Mm-hmm.
I just didn't understand the difference between the two, but Marlene, thank you. That was helpful.
Sure.
Thank you,
And
Caroline.
in looking at the resolution, especially giving the energy around the conversation today, I do think it would behoove us to take some time. We do have a little bit of time on the call today to walk through it in a similar way that we walked through the letter. Again, I'm not sure if Dana has the versions with the line numbers. We got through the last one. We'll get through this one if we don't have it available. But
Dana, are you able to share the screen with the letters, with the numbers?
This is the only version that I have.
You should have it. Me and Damon both sent it out, and it's in the invite. So
Okay,
I'll resend it to make sure.
And open the one that's in the link, right? Okay.
Well, the link will be a PDF, so it might be better to work off of the document.
It's going to take me a minute to get that.
If it's helpful, Dana, it's probably still you. I don't know if it's helpful to move to the stigma document. Do you have that one available with the numbers on it?
On deck.
Again, I have the versions that were sent to me a couple days ago. I don't know that I have. Here they are from Caroline. So if you'll just give me a minute, I'll capture this.
Okay.
We're on U. Okay.
Yeah, U equals U if you want to address that first.
Oh, I see the problem.
Dana, so it should be the attachment 2.
I've got it.
Okay.
Yeah, I've got it. The problem was me. Sorry. Yeah, I just need to move around a little bit, excuse me.
No worries, you're doing great. We appreciate you so much.
That's a lot of work. Thank you.
You're welcome. Can you see this?
Yes,
Yes.
Okay. Is it big enough to read?
plenty.
Okay.
Okay, we have the first three whereas. If you all want to take a minute, read through those, and at least now we can refer to specific line edits if anyone has recommendation.
Line 4, routinely to routine. And do we think it's implied there, HIV testing, or, I mean, my thought would be to add HIV there.
So thinking again about my original question about how is the resolution used, and it may be used more publicly than a direct letter to the secretary. I wonder if we need to define what undetectable in quotes is. Right? I mean, if the use is more public than a secretary letter. So that's line 3. And I guess you want exact words, don't you? And yeah.
I pulled that from the NIH website the other day. I actually have it like queued up. I can paste it into the chat. Just as like a draft for the draft.
And I'm not, again, thinking about who this goes to. Is it someone who is on effective antiretrovirals? HIV medications is kind of a broad.
And I like that. And again, I don't think this draft was as vetted as the previous letter.
Yeah.
So this is probably more rough than the other.
Mm-hmm.
So if you have thoughts or recommendations, I just felt we've got a couple of minutes today if folks wanted to walk through this document collectively.
And it's actually they cannot transmit, not they do not, right? Line 4. Yeah, this needs. I'm not usually one on wordsmithing, but this needs some work.
Yeah.
And I just pasted like the quote from the NIH's website. Or rather the definition from the NIH's website into the chat.
Yeah.
I think in the second paragraph, line 9, I'm not entirely sure that the word required by PEPFAR and the Global Fund is accurate. I think we might just need to double check that.
Mm-hmm. Mm-hmm. Right, that's the.
How about recommended? That might be a safer word to use. Is it recommended?
I think there was a
Encourage.
slide that had something more than recommended, but not necessarily required in their presentation earlier.
Yeah, I'm thinking of
It may very well be correct that it is required, but I just
That kind of
ask the committee
sentence
if
is
they
the
would
thing
make
that
sure
needs a
that that is accurate.
citation too. I mean, there are citations in here, right? So if you're saying something is required, it needs a citation, doesn't it?
And I don't know if it's required by PEPFAR, but PEPFAR may require it for PEPFAR recipient nations or ministries of health. I think we need to be clear about how this section is phrased.
and given the fact that we don't have the main authors of this document with us. I see that DeAndre is still on, and I know Tori had to drop off, but I'm gonna make a recommendation that we all provide comment about what we see in this document back to that subcommittee, to Guillermo and Tori, have them work with DeAndre around some of the recommendations to bring back, for lack of a better term, more refined version for consideration. And my hope, as I reiterated, Guillermo, is that it does not wait until our December meeting. There's lots of opportunity for this resolution to really have some impact in and around what we know will be conversations stemming from USCHA, what may be happening in the broader political, local, state level landscapes, as well as World AIDS Day. There's just lots of ways this document could be very useful in the community. So that I would encourage and recommend PACHA members to strongly give some weight and review to the document quickly, so they can incorporate all of that and sort of bring forth a more refined version for us to consider and vote in another format. Does that sound doable for everyone? Does everyone agree with that proposal?
Wise.
Okay.
I do.
Okay.
Marlene, do you think we could put some time limits around that? Because before December's meeting could be the day before, whereas I think there's a sense of urgency here.
It would be great if we could have comments and edits submitted to Guillermo and Tori before USCHA.
Thank you. I was going to say, yeah, Ms. Marlene, I think if we can set that precedent to have it before USCHA, then how would we then vote as a full council? Is that possible to make this a virtual vote, or how does that work?
There is, absolutely, DeAndre. We've done that before, and not a terrible lift to do. So the voting can happen at a time that is appropriate for post USCHA. But I think getting the edits into you all, to give you all some time to incorporate those edits, make some considerations around how you might refine the letter, and then be able to bring that back for a vote. I do want to give appropriate time limit to it, but yes.
But could I suggest, Marlene, that it not be before USCHA, since we have a PACHA-to-the-People, and we have a PACHA listening session at USCHA, might inform what PACHA members might want this document to say.
That's an excellent point. You're right. We will be engaging quite a bit at USCHA. Tiomi and Caroline, before we go, Tiomi, I just want to make sure we got your thoughts.
Yeah, no, it's not about this. I agree with everything you say, but I've heard a few times about the December meeting, and I don't have it on my calendar. Has it been sent out?
It should be, but I'll make sure you get it.
Okay, thanks.
And I will just a few things about this in terms of calling another meeting. Absolutely, you can call a virtual meeting just to do a vote, but just a reminder to our PACHA members that we can't just call and say we're going to have a full council meeting tomorrow. We have to have ample time for the meeting to be in a Federal Register notice, so it's open to the public. And so it does take a few weeks once we have that date. I will say the EHE subcommittee is meeting the week after USCHA. I think it's Monday, the 19th. So Guillermo, might be great for us to focus that subcommittee on this resolution, use that time, but just food for thought. Thanks.
Yep.
Two questions. One simple one, how do you want comments, just by track changes? Or what's preferred?
Track changes is the thing is always.
Okay, and then a question, I'm sorry the document's gone, but towards the end, there was a piece about supporting the U=U University. And I'm just wondering, is that something that
it would probably phrase more generic.
Yeah, okay, because it sounded like that's my question. That was a very specific program that I was wondering about how that, yeah, okay.
And apologies, I think obviously the timing is important and that was the spirit, but we will try to consolidate because it's too long also. And I
Yeah.
always believe that the best resolutions are the ones that are compressed by 1 page or 2 page at the most.
Yeah, yeah. I do
I'm
think
laughing
though
because I think MHS was like 4 pages long, but we try our best.
I know.
I also think it's good that we started this conversation today, building on the momentum of the presentation, right? And keeping it going. So even though it wasn't solved and finished today, the fire's lit, right? So
Yeah, and I'm grateful the council had a chance to just at least take a look at it and hear and see the sentiment behind what was coming from this subcommittee, even planning for the conversation that we were going to have today. I'll take DeAndre and Mackenzie quickly because we'll have to get through the stigma and their recommendation next. So let's
Yes,
take
ma'am.
these last two comments. Go
Yes,
ahead.
ma'am. I just wanted to say, and I'm not sure how possible it is to put this on the agenda. I'm doing USCHA, but if it is possible to have this conversation and to bring this back up, as Jesse stated, during that listening session, and make folks aware of this as we are all going to be there for those who will be at USCHA, making this more a priority since it is still up there in the air.
Yep.
And then, gosh, I love deadlines. And then we want to move it to after USDHA. I don't know if we pegged it to an exact date. Do we want to say like by end of day Friday, the September 20th, the week after USDHA?
Well, I think the sentiment was the work group or the subcommittee would have their meeting on the 19th and would use that opportunity to discuss this document and any edits. So I think we're saying our deadline might be somewhere around the 18th at a minimum. So they would have
the next meeting, I'm so sorry to interrupt, is the Monday, the 16th for the
the
EHA.
16th. So at least the 15th, right?
Well, so that's the Sunday of USCHA because the meeting is on Monday.
But it would have been after our listening session for sure.
Correct. Yes. Listening session is the 12th, which is that Thursday. So that gives that Friday some time, or anything before then. Still got 2 weeks now before then.
right. I think people can work on it in the interim and then maybe add to it after the listening session.
That's right. Okay.
Well, I should say that's what my plan is. That's my plan.
Yeah, that I agree, Carol. That's my plan as well. I've given some edits, and I'll have opportunity to go back and refine. But we are grateful for EHE and for you guys and the work that you did to bring forward the U equals U conversation. Riveting today. We could have gone likely all day, but just want to appreciate the work that you started already. And I do think this resolution has the potential to have really much needed impact in communities across the country. Let's make sure that we have ample time for the remainder of our agenda today to focus on another important recommendation coming forward with Stigma and Disparities Subcommittee leaders, Rania Copeland and Leo Moore. I'll turn it over to you guys.
I said in the chat that I'm in transit, but I'm super excited for the work that this work group has done. And I think I remember when we talked about PACHA and what kind of impact we can have. And one of the questions we came up with, particularly in the Stigma and Disparities subcommittee, was we challenged the work group to think about, what is the big idea, the so what? I feel like this resolution is part of that so what. So I'll give it to Leo, who I think will have Guillermo walk us through it.
Yes, thank you. Thank you. I'll go ahead and hand it over to Guillermo.
Yes. Thank you. And again, on behalf of Defina, that unfortunately is not here, she's the chair of the Stigma Disruption Work Group under the leadership of our two co-chairs, Leo and Rania of the Stigma and Disparities Subcommittee. We are honored to present for your consideration full PACHA the following resolution. Can we bring it up to the our folks? And it was part of the email that was sent. Beautiful. Very, very straightforward. The resolution And by the way, this resolution was motivated by Steven Vargas, that our Houston PACHA-to-the-People person living with HIV in Texas brought to us something that we know. And the resolution, I think in a very concise ways, outline that this resolution wanna echo the idea that stigma is the biggest barrier. The resolution called for adding as a 5 pillar of the national HIV/AIDS strategy, and to identify stigma again as the structural and major barrier to secure delivery of services free of stigma and discrimination. And that's what the resolution called. And again, it's a very several arguments about stigma, how big and how structural it is. But what is called in the resolution is to adding as the 5th pillar of ending the HIV epidemic, national HIV/AIDS strategy. Comments, react, or questions from the PACHA? Milan?
Of course, go ahead.
So the final resolution at the bottom says add stigma as the 5th pillar in the ending the HIV epidemic. But Guillermo, what you just said in your commentary was adding it as a pillar in the national HIV/AIDS strategy. But aren't these two different things?
Yes, as a boo-boo there. Thank you for cutting that. That's your legal eagle-eyed to request to add as a result. In the bottom, please. Yes, to be resolved to add stigma and eradication as, wait a minute, and stigma as the 5th. The word eradication, to add, I'm sorry, the missing word is to add stigma and eradication as the 5th pillar of NDHP. We missing after be it resolved to add TO. Yeah, right there. Sorry
And
about
and shouldn't it say ending the HIV epidemic plan? What is the official term, Jesse?
Well, I think the ending the epidemic plan is about those 57 jurisdictions. The national HIV/AIDS strategy is about the entire country.
Correct.
Which one are we talking about? Or did you only want it to be for the ending the epidemic plan?
No, it has to be edit there. 5th pillar of the HIV/AIDS national strategy or national HIV/AIDS strategy.
Yeah.
Correct. Good eyes, Carol in Milan.
I'm sorry, I
Previous
don't understand. This is Dana.
As the 5th pillar of the national HIV/AIDS strategy.
But
So,
this is
line
Dana.
30.
This is Dana speaking. At the very beginning, you were talking about the ending the HIV in the U.S. initiative. And
So
it's
can I
4
pause this for just a
pillars.
second? Because I think that before we agree upon the edit, I think that there's a discussion that's happening. Guillermo, you're saying it's not EHE, it's NHAS. And I just wanted to check with the rest of the work group. I think it was EHE because there was a specific ask for there also to be, if we can add it to EHE, there's funds associated with it. And so jurisdictions within EHE would then have resources, hopefully, that would be able to focus on stigma eradication. But maybe I understand that wrong. So I think that point of conversation we need to have.
But it sounds like two, and so I'm adding an and, that there's required and maybe necessary appetite to talk about stigma in the broader HIV response other than those funded jurisdictions.
Correct.
So I think there is real distinction here that we need to clarify. What was intended to come from stigma disruption, ultimately this subcommittee, stigma and disparities. This particular action is only centering around those funded jurisdictions, right? And that's an action we want to take. But there also seems to be a need and appetite that's broader than just those funded jurisdictions. So I think you're right. We're calling it out. That's the tension. But just putting it out there. Patrick, I see your hand up. Go ahead.
Yeah, I mean, I think there are currently 6 indicators for I think the AHEAD dashboard, which is the ending the HIV epidemic. And so like another question is, and maybe it's semantic, but another thing to call for would be to have this as an indicator. And I think that there's this saying that's like what gets counted gets something, what gets measured. I mean, I think if we're going to call for it, then it really should be something that we call on to be monitored, and the just how, like, where that stands throughout the jurisdictions. And there are some mechanisms for that, and I'm happy to geek out on like where those data might come from. But I think just the clarity around where it's called for and what is called for. But if we feel like it's critical to ending the epidemic, which I think we do, then I think that part of the call should be to have an indicator and monitor that and make it public through the AHEAD dashboard.
Because Defina is not here, I relate to Rania and Leo, because I agree it has to be a, in order to move this has to be a committee, and we are a work group under the subcommittee of stigma and discrimination. And then I refer to Rania and Leo to because that's a fundamental issue that Patrick is mentioning. The original intention in the work group was how we elevate stigma, because if you notice right now, the 4 pillars do not have a stigma as a major critical issue, but the indicator that Patrick is referring is critical.
No, absolutely. And I think that's why there's lots of energy around supporting what PACHA might want to say around stigma and stigma disruption. Let me lean quickly to Rania and Leo for your thoughts.
I love it. Let's throw it all in there. I think we could add, I think the intention was around EHE because there's some resources, and I think that we can have something tangible quickly, hopefully, around that. But I think adding it to NHOS and maybe asking for it to be a priority makes a lot of sense. And so the distinction is important, and I think that 100% with, and I think we can do that. And then I would just have a note or a thought. I think Defina was originally thinking maybe this is something that we discuss today and then approve potentially in December. And so that can be something that we do as well if we want to have some more discussion. The only thing I would add to that, though, is we know we have a major election coming up, and is there value in trying to get this done sooner rather than later, so that if there are kind of hopefully changes that can be made, we can see them not be swooped into whatever kind of things happen post-election. That's what I would add, and I'll hand it over to Leo.
Go ahead, Leo.
So I agree with Rania and with the sentiments that everyone has shared about having one resolution that would encompass both NHOS and EHE. I think that we should take this back to committee and incorporate those additional edits that we want to make, broaden this out a bit. And then I would say, I think maybe bringing it back to the December meeting.
Appreciate that, Leo and Rania, and I would echo that 100%. I appreciate your willingness to sort of honor all of the recommendations coming from council. Thuvia and Jesse.
Oh, thank you, Marlene. Just for clarification, then we are going to be, because the goals of the National HIV and AIDS strategy resonate with the pillars under ending the HIV epidemic in the U.S., they're very similar and they are very much aligned. We are going to be adding both of these languages and merging them and kind of marrying them together. Is that correct? I think that's wonderful. That I 100% agree.
Correct.
Thank you for that clarification.
Yep, absolutely. Jesse.
Right. I think that sometimes the community, as well as all of us, get confused between NHOS and EHE. So I think this will be helpful to make sure that this is that this document combines or refers to both. But I don't know that we have to wait till December, Marlene, because if we're going to have a special virtual vote or session to vote on the U=U, this resolution seems almost ready to go with the minor edits, with the edits that we're talking about, to add a stigma indicator to NHOS. We might be able to do both virtually prior to December.
I would absolutely agree with that 100%. My only pause, and not that we ever have to wait until 3 months later to our next meeting, that's not what I'm insinuating, but I am giving some thought to the individuals that would be required to pull this together and what I know they're involved with between now and the next, I don't know, several weeks. I'm thinking explicitly of Dafina, who is leading the planning committee for USCHA. I know is planning to have some time off after an extremely busy year of her own organization's work. So just trying to be mindful of what will be practical and doable in the short term. But I do think it does not have to wait until December, but not sure if we will successfully sort of align up those timelines. I don't want one action to delay the other. But I hear your sentiment. If it's possible, let's work toward making sure that we sort of give that charge to the committee, the subcommittee, that if they can work and set good timelines that make sense for them about how they might get back to a good document for consideration. I really want to lean on them. I just know them all and what they're doing for the next couple of weeks. Am I speaking out of turn, Rania, Leo?
On the money.
Okay. Dr. Chan, go ahead.
Hey, just a quick comment. Just as I was processing this, obviously, I think that we all think that stigma is of the utmost importance. As I was thinking about this, though, the only thing I struggle with is that stigma doesn't seem to me to be a pillar. It seems to me that stigma is sort of cross-cutting across all those things, whereas as the pillars are sort of discrete entities. So maybe as a committee just thinks about this and how to tease it out. I really did like Patrick's suggestion about trying to measure it and capture it. And I guess I just wonder if there's a way to sort of weave it in more, because it is so cross-cutting. It doesn't seem like a pillar for me. It really should be one of the basis of all the pillars, right? Frankly. So just wanted to pass that along for consideration.
Good point.
Any other comments or thoughts? I think we've done some good work this afternoon, looking at the recommendations and consideration of thought coming from our subcommittees. I thank you all for the work that you have put in thus far. And I know we have some more to do to get to refinement and full vote, but excited about our passing of and agreeing on the letter of submission to the secretary for those aging with HIV, and the work led by Jesse as well as Alicia. And just thanking everybody. It's been an extraordinary 2 days. I am excited that we were able to pull together such a meaningful agenda. And Patrick, Jen, you all are rock stars. DeAndre, Tori started us off strong today. Francisco joining us from all parts of the world, from Berlin. It's just been extraordinary, the participation and the energy with giving serious consideration to the work that we have in front of us to do. So I don't have a lot to say to wrap us up today, other than thanking all of these fabulous people, and of course to Carolyn Talib and Chloe Loving, who have done an extraordinary effort in pulling us together in meetings all year round, including this one, and to our partners, Rosalie and Associates, who keep it together in HHS Studios. It's not easy managing all of this work. So I just be remiss. I have to acknowledge them and the work that they do. And our leaders, Kay Hayes and Tim Harrison and the Office of Infectious Disease Policy, thank you for your support of PACHA and helping to keep us relevant and timely on the topics that we should be focusing on. And Guillermo, you have a
Yes.
hand? Yeah,
2
go ahead.
seconds. I just want to acknowledge all the people that you say, but also I want as a PACHA to send our collective love and comfort to Paul and his team at EDMAC. They're working around the clock, putting together USCHA in New Orleans, and it's focused on the South. And I always say that the only way to end the HIV epidemic is through the South. And then just to send in good energy for those and safe travels, people that will be heading to NOLA. Thank you.
Here, 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 here. Thank you, Paul. Thank you to you and the team. Looking forward to seeing everyone in a couple of weeks. And thank you all for the last couple of days. We are officially adjourned. Bye.
Produced by the U.S. Department of Health and Human Services.